Okay, good morning. My name is Alan Levine. I'm the chairman and CEO of Ballad Health. Before I get started, first of all, I want to say thank you to everybody in the community who, in their own way, are trying to be helpful. We've got folks over at Streamworks and at ETSU making face masks. That's the one supply item that we've had concerns about, and they've stepped up. We have people all over the region through our interaction with churches. We've communicated with over 200 churches throughout the region in conjunction with Summit Leadership's Church Mobilization Network to discuss with them ways that we can support our team members who have children. We obviously need for our team members to come to work if we are to face a surge. And the volunteerism that's been out there, people that have been interested in trying to help, has been frankly inspiring. 13 churches so far have responded, plus the Three Rivers District of the United Methodist Church. And they plan to share our request for support to the entire Holston Conference. There's a Christian-based camp that's working towards developing programming aimed at children that we want to keep isolated while their parents can work. The YMCA in Kingsport is mobilizing. I know that the Boys and Girls Club here in Washington County, Johnson City, has expressed an interest in using their resources to provide support for children of healthcare workers and other essential workers. So those are great examples of the community coming together, people sewing face masks. That's amazing. And I think as we face a situation like this, people ask, what can I do? People want to contribute, they want to help. Obviously, the most important thing you can do is to stay at home if you don't need to be out. If you are in an essential job or an essential role in the community, whether you're a healthcare worker, a manufacturing job, or sanitary worker, water treatment plant worker, clearly we need you to keep showing up and doing your work. But if you don't have to be out, really, we're at a cusp right now where we're facing either we can slow down this thing or we're going to see it accelerate. As it is now, we have approximately, as far as we can tell, 20 confirmed cases throughout our region. This morning, as Jamie Swift will report to you shortly, we have had some additional cases in the last 24 hours, and I'll let Jamie talk about that momentarily. There's no new information at this point about the reagents that we are anticipating receiving from Cepheid Labs. That's the company that provides us the analyzers so that we can do the real-time lab testing. We are in contact with them daily, encouraging them to release those reagents to us. As soon as we get those, we should be able to move towards real-time testing. As I've said, 50 tests per day, expandable to 400 per day once we get the other analyzer that we've acquired. We've no significant changes from 2 days ago with the supplies. We've ordered additional supplies. I think, again, based on what we're seeing in the community, I think that we're in a good shape, with the exception of the face masks, which, as we've already mentioned, there's work being done on that. We currently have 173 available ventilators. That number's up from what we reported before, based on our current utilization. We've seen a dramatic decrease in the use of our hospitals in the last week. Our inpatient surgeries are down close to 60%. Our outpatient volume, outpatient utilization is down 40 to 60%, depending on the type of service. Our physicians have heeded the guidance to only provide services for things that are essential based on what the real, true, urgent needs of the patients are. Obviously, that's having a major impact on Ballad Health, as it is health systems all over the country. I don't think that we're unique from that perspective. We've had almost 9,500 calls to our Nurse Connect. And we realize that there are times when you call where we get surges. If there's a time that you call and you have an exorbitant wait time, we ask that you be patient or call back. But know that we're continuing to ramp up our resources at the Nurse Connect so that we can be prepared to handle any situation or any questions that folks might have. A quick comment about we had a couple questions about our strategy in Wise County. Our approach to preparing for the potential volumes that we might see. We have 3 tertiary hospitals, Holston Valley, Johnson City Medical Center, and Bristol Regional Medical Center. Each of those hospitals has finite capacity for ICU, intensive care, pulmonary services, and obviously ventilator capacity. Our strategy is designed around trying to make sure patients utilizing those high acuity, high intensity services, that they have the ability to access those services. Beyond that need, throughout the region, we are standing up capacity where we need to, so that we have, I'll call it transitionary capacity. If there is an outbreak in Southwest Virginia in the area served by Wise County, we have a facility at Lonesome Pine where people can go. They can be assessed. If their needs are low acuity, we can provide services for them there. If we believe, based on protocols and what we're learning about this disease, that we have a higher risk group of folks, if they're elderly, if they have multiple comorbidities, there's a high degree of likelihood that those individuals will be transferred to Holston Valley, Bristol, or Johnson City Medical Center, because we want to make sure, in the event their condition worsens, as we've seen it can worsen rapidly, we want to make sure they get where they need to be. So we're clear, Ballad Health has the ability, because of our structure, to repurpose facilities and capacity based on creating tiered services based on the acuity of the patients. And we've got a lot of doctors and experts working on that right now. And you know, we're all facing this for the first time, so there's certainly input that folks might have to help us. We certainly would appreciate that, but we need to let our doctors and nurses and clinical leadership develop those protocols so that we can deploy them fairly rapidly. Yesterday, Congress, the United States Senate, passed unanimously the CARES Act. We are very grateful for the work that our delegations, both in Tennessee and in Virginia, have done on a bipartisan basis. Senator Kane, Senator Warner in Virginia, Senator Alexander, Senator Blackburn in Tennessee. We've had contact with all four of our senators. I've personally spoken with some of them and their staffs, and I will tell you that the outreach from them has been very helpful. We are still in the process of analyzing the very many different components of the CARES Act, so we can determine how it would impact us and how we can best take advantage of what's been provided for the benefit of our team members and for the benefit of our health system. As I've mentioned, you know, Ballad Health is no different from all of the other businesses in the region, from the standpoint that we have faced a massive decrease in the demand for our services, and that obviously has an economic effect on Ballad. Right now, you know, typically Ballad Health, our days cash on hand is generated or is determined based on what our daily spend rate is. On a usual day, Ballad Health spends $5 million a day. That's what we spend. Half of that is spent on labor. The other half is divided amongst things like supplies, and all the other expenses that it takes to operate hospitals and a health system. And when you're spending $5 million a day and your revenue is decreased by 40% or more, obviously it creates an economic strain on the health system. That's no different than what restaurant owners are experiencing or anybody else whose business has been affected by this. What is different about Ballad, and what we have to balance, is that we're facing a pandemic, and at the same time we have to deal with the cost of sustaining our services. We also have to make sure that our workforce is prepared and available when and if we need them. And so these are things that are very complicated and very are requiring a lot of work and a lot of effort by folks to determine what our needs might be and how we plan to staff for those needs. For the time being, what I can say is this before I turn it over to Jamie. We've had the chance to get out in the field and talk to our nurses and our physicians, and you know, they are heroes, as you're starting to see throughout the country. And even here, this morning as I drove in, I saw a sign outside I saw some signs outside our corporate sign referencing our healthcare workers as heroes. They really are. They expose themselves, even without this virus, they expose themselves all the time to dangers that you or I couldn't comprehend. Infectious disease, people that are facing addiction, people that sometimes are violent. Our nurses and doctors go through things that people cannot possibly understand. And we see it all the time. And so it's, you know, on the one hand, while we want to express our empathy and our thoughts and prayers for all of the businesses, both the owners who have had to make hard decisions and the individuals who are being impacted by those decisions, We also are grateful for the empathy that our community is showing our healthcare team. We are working hard to be prepared for this, and we're deeply committed to the health and well-being of this region. And so with that, I would ask Jamie to come up and give an update on the data that she's seeing, and then we'll turn over to Dr. Runnels to give an update from his perspective as well. Jamie?
Thanks, Alan. Thank you to our media partners for covering today. I'm Jamie Swift. I'm the Corporate Director of Infection Prevention. So as Alan said, we wanted to give you an update on our numbers. Right now, reflected on our state websites, we're reporting 20 cases. We can confirm that this morning, as of this morning, Ballad has identified 3 more positive cases in our region. 2 of those are in Tennessee. 1 of those is in Virginia. I know there's some confusion with numbers. Most likely those will not come out on the state websites today. There's usually a bit of a delay on those numbers. So while we're working those cases, it will most likely be tomorrow or a little bit later before you see them actually on the state sites. We really want to stress, I know you've seen in the Tennessee numbers that about half are that age 21 to 40 in Tennessee, and we're seeing that same thing right here in the Ballad region. So of the 11 that Ballad Health has actually confirmed and diagnosed, 8 of those have been in that age range of 21 to 40. And so we really want to stress, as we're approaching this level of community spread, and we're starting to see that, we're really pleading with certainly that age group, but all of our age groups to stay home, really practice this physical distancing. So really changing that from social distancing, which can sometimes make people feel really isolated. I think our focus needs to be on physical distancing, keeping that 6 feet away, staying home, only going out when necessary, essential jobs, to the grocery store when you need to go, really limiting contact at this point. As Alan referenced, we're at this point, we can either really slow this down or we can see it starts to take off from here. So we're asking for your help today and throughout the community as we face this. And at this time, I will turn it over to Dr. Runnels, who is our Chief Physician Executive.
Thank you, Jamie. And I'd also like to thank the media for the coverage that they've given, support that they've given. And I'd like to reiterate what Alan said regarding our team members, our caregivers. They've had a tremendous effort in planning for the pandemic and have done it with a heart for their community, and we really appreciate the work that they're putting in as well. Like Jamie said, we need to take this very, very seriously. We are at a point where we're at the base of our curve. We haven't seen the rapid upswing with community spread at this point, which we're expecting and obviously preparing for. We've heard many comparisons from various people regarding comparing COVID-19 with the flu, and I wanted to address that just for a minute. COVID-19 is definitely not the flu. First of all, this virus is much more infectious. It also has a much higher rate of serious illness requiring hospitalization or even critical care. And furthermore, this virus has a broader range of symptoms, which makes it much harder to track. Those symptoms can range from people who have little or no symptoms all the way to serious, critical care type symptoms, life-threatening symptoms. So I'd like to reiterate what Jamie said, that it's really important what we do right now. We've never been more dependent on each other for our behavior and our health. And it's really important that you stay home and that you follow good hand hygiene and additionally follow the recommendations regarding physical distancing. And I think those are our prepared comments, and it's time to open up for questions.
Thank you, Dr. Runnels. And as we talked about on the phone, we're going to go in order, 2 questions each. So right now we have Blake Lipton with WJHL. Blake?
Yes. Are you guys seeing any community spread? And if so, will that change your criteria for testing or anything else that you guys are doing?
Okay, so the question is, are we seeing any community spread? And if we see community spread expand, will it change our criteria for testing? Did I say that correctly, Blake?
That's correct.
Okay.
Any community spread?
Well, there has been yes, we're starting to see evidence of a little bit of community spread. as we see that occur, we obviously notify the health department. We're obviously working closely with the health department. Then what they do is they will trace the individuals who are affected so that they can contact any of their contacts, again, to try to contain it. So there's a lot of efforts from an epidemiological perspective that are being deployed to prevent spread when we do find it. But the answer is yes. As Dr. Runnels said, that's a great way to put it. We're right at the base of that curve where we're starting to see it. You know, initially, most of the cases, well, all the cases we were seeing initially were cases where people had traveled and come back. Obviously, that now lends itself to contact that those individuals may have had, which then creates spread within the community. So that's where we're at. As to the criteria, we're going to stick with the CDC guidance, and I think that's really the best place for us to be right now. Based on what we're seeing in terms of the testing, the number of tests we're doing versus the positives that we're seeing, it seems that we're catching those that are calling and asking to be screened. So the process right now seems to be working. Obviously, there are limitations. The limitations relate to the things we've talked about: supplies, personal protective equipment, and balancing those different issues. I think our situation will get better once we have the reagents that we need to do the live results turnaround here. And we were expecting to have those reagents this week. We do not yet have the reagents. We are certainly in daily discussion with the lab company because we do think that will help us.
Blake, do you have another question?
Yes. Have you designated a Northeast Tennessee hospital for coronavirus?
Well, we are working on that. The answer is yes. We're not prepared to discuss that yet till we have our plans in place. We also have one for the Southwest market. Again, the approach is folks that are lower acuity that present, if we can do everything we can to keep the strain off of the major tertiary assets where we have the most resources, that's our objective. Now, by the way, I should say, just because we have those resources at Holston Valley, Bristol, and Kingsport, that does not mean we do not have those resources at other hospitals as well. For instance, Johnston Memorial in Abington's got a very highly functioning ICU with pulmonary support, and some of our other hospitals do as well. So we're taking a systemic approach to this. And when we say it's a COVID hospital, we want to be clear. It's a first stop transition towards making sure we assess people and get them to the place that's appropriate. Lower acuity patients that can be treated closer to home, that's better. But when you face people who have high acuity needs, where you need much more intensive support from physicians and nurses that are better trained for that, then those are the cases we're going to try to get to the higher acuity facilities. But right now, I can tell you, Holston Valley, Johnson City Medical Center, Bristol Regional Medical Center, Johnston Memorial in Abington, to some degree Indian Path, these are hospitals that have a history of running pretty high intensity intensive care units with good surgical programs. So I think that we have the capacity there to be able to do the proper handoffs.
Thank you, Blake. Now we have Taryn Young with the Coalfield Progress.
Yes, I am calling out of Wise County, Virginia. There's a lot of concern about what's going on at multiple times. Can you go into more detail about testing? Is there drive-through testing, and how many cases or potential cases you're seeing coming to Levine Hospital?
Yeah, we are doing drive-through testing in Wise County. Right now it's at Norton, correct? Yeah, so it's at Norton. Again, the reason we've done what we've done there is there's work that has to be done to again, we haven't started to see a surge. It's important that the work we're doing now is for the purpose of preparing in the event we get a surge. So there's work right now being done with the leadership of Wise County, the CEO there, Mark Leonard and his team, He's got a very good team working in concert with our infection prevention staff, as well as our physician leadership at the Ballad Health level. They're working right now on developing their clinical protocols. That's the process that's playing out right now. What I would ask people to do is be patient, let them do their work. And as we develop our strategy, we will definitely communicate that. So right now, there's nothing for folks to react to. Let our clinical team do the work they need to do so that we can be prepared if and when we get a surge. This is all about preparing. We're not facing a surge right now, but we are putting resources and pieces in place. So if we get a surge, the time to fly the plane is not, the time to build the plane is not while you're flying it. You want to build the plane before you have to fly it. And so that's the process we're going through right now, is we're sort of building the plane. So just give us a few days to put our clinical protocols in place, work with our staff, educate our staff, do the proper training with our staff, and then we can have some more detailed discussions about it in the coming days.
Taryn, anything else?
Also with the demographic of the community here, what cause can patients expect for treatment for the virus if they're uninsured?
I'm sorry.
Cost of treatment that patients can expect.
Well, so again, in Virginia, there's a different situation in Virginia than there is in Tennessee. Virginia has done the Medicaid expansion. So folks who are low income, below, I think 130% or so of poverty, qualify for Medicaid, and we will certainly help get them enrolled if they need that coverage. Ballad Health has one of the most generous charity policies in the United States. If you are low income up to 225% of poverty, we are deploying what's called presumptive eligibility, meaning we've waived our required paperwork. We're using publicly available data to determine that you're qualified, and if you qualify, your care is free at Ballad Health. If you are up to 450% of poverty, which is well in excess of the median salary in our region, then your care is deeply discounted to the point where it's very low cost. But so if you're low income and you're in Virginia, the chances are there's a high degree of likelihood that the care you receive will cost you nothing. Most of the people that are likely to be affected by this are going to be over the age of 65, because that seems to be the population that has the highest acuity need, and most of that population is covered by Medicare, and the federal government has taken steps to assist hospitals with the cost of that. I won't go into all the details about how that's going to work, because at this point we don't really know. In Tennessee, the governor of Tennessee has requested a waiver or a state plan amendment, I'm not sure which, from the Centers for Medicare and Medicaid Services, so that if you would have other qualified for expanded Medicaid, you will qualify if you are diagnosed with COVID-19. So the governor of Tennessee has taken steps towards making sure that people who are low income have coverage in the event that they are hospitalized or experience the need for hospitalization. So that's what we know right now. What I can tell you is this: Ballad Health is going to take care of anybody who shows up that needs care, period, end of story. What this all looks like later in terms of finances, these are just things we're going to have to work out with the federal government, with the states. But what I would tell people, the most important message is, if you have symptoms and you need help, get help. Ballad Health is going to take care of you, and your financial status is not a factor in whether or not you get care. We will take care of you.
Thank you, Taryn. John Engel with WCYB, do you have any questions?
I do, and probably not surprisingly, I have more than two. And I would hope not to burn that on more information about these new cases. Can we get a little bit more depth on at least the county explanation, or who these patients are, other than just Tennessee and Virginia?
Hey, John. So the Tennessee cases, we have one that's coming out of Unicoi County, one that's coming out of Sullivan County, and then our Virginia case is Washington County, Virginia.
Okay, I'm assuming that that's the case, and we got confirmed by public health officials yesterday that preceded the Virginia Department of Health announcement.
No, these were confirmed this morning at Ballad Health, so you won't see these numbers until most likely tomorrow.
Okay. And additionally, are you having to test or have you tested more team members? I know that you had the one team member who tested positive and is in quarantine. Have we seen more positive tests for Ballad Health staff? And can you even give us a number on how many have been tested within the system?
I don't have a number off the top of my head, but I can tell you that we've had very few that we've had to test. So we're using the appropriate PPE like we've shared. Most of these have been diagnosed within the drive-through setting. And so because of that, we're in the appropriate PPE. So there's actually been very few that have had to be tested.
Thank you, John. Brittany May with the Elizabeth. Oh.
I think that we agreed we wouldn't let it make him burn the first question.
Oh, okay. Go ahead, John.
Okay, yeah, thank you, I appreciate that. We got a tip on this, I don't know really how else to present this, but we were told that there was a patient in Sycamore Shoals that was suspected of having COVID-19, was tested some 11 days ago and passed away while in the care at Sycamore Shoals without the test results coming in. Have you heard anything about that? Is there any strength to that?
No, John, I don't have any firsthand knowledge about that. I'll have to follow up with you. That's first I've heard of this, but I don't want to speculate. Let me follow up with you and get you an answer.
Thank you, John. Brittany May with the Elizabethton Star. Do you have anything additional?
Yes, I do. So I've noticed that numbers are increasing in Tennessee daily, and I was wondering if this is due to more people being tested or if it's due to people not following guidelines. That's my first question.
Well, that's a good question. Some of I don't want to speculate on the answer. What I can say is, as we've been predicting for over a week now, maybe even longer, that as more testing is done, we will likely see more cases. So at least some of the increase in the number of confirmed cases can be attributed to the increased testing. How much of the increased number of cases is tied to people not heeding the recommendations, I can't answer that. What I can say is it's also true that we've had people from this region travel away and come back and test positive, and then subsequently we've seen some community-based spread. So I think the answer is probably a little bit of both, but I'd leave that to state leaders to address.
Okay. And I was also wondering, now that it's considered community spread, what is going to be the criteria for people to be tested if they start exhibiting upper respiratory symptoms, et cetera? What can they do to be tested? So
we're going to follow the CDC guidelines. Now, we'll say when somebody calls our Nurse Connect number, now I'm only speaking for Ballad Health because you have ETSU doing testing, you have other private physician groups, HMG, SOFA, medical care. I think each of them is testing their own patients. So I can't speak for what criteria they're all using. I'm pretty sure we're all relying on, as a basis, the CDC guidelines. But the reality is, when people call the Nurse Connect number, they're talking to a nurse, and the nurse is doing her or his own assessment. If they determine, based on the symptoms and the severity of symptoms, that the patient is disclosing, then that patient is connected with a physician, and the physician can exercise their own judgment. So if the physician, based on the totality of issues they're being presented with by a patient, that physician will then potentially refer the patient for testing. Or that physician may tell the patient to go straight to the emergency department based on the symptoms. It's really, we really do rely heavily on physician judgment here. And typically what we're doing is we're trying to rule out flu, RSV, or other types of more routine or typical respiratory illness before we do the test. So that's sort of the process that's used. But as we're capable of doing more testing, and as the CDC guidelines adapt to that, you'll see us probably expand the protocols based on that.
Thank you, Brittany. Tim Dotson with the Bristol Herald Courier. Tim, do you have any questions?
Yeah. So when you all use the term community-based spread, what are criteria that you're using to define that term, and
Well, you actually just defined it. It's if we see a case and there's no known travel or no known contact with somebody that has it, then we refer to that as a community-based spread. So you actually defined it exactly the right way.
Anything else, Tim?
Thank you. And I just want to ask, so we're talking about like social distancing, but a term that I think Jamie, you sort of used to, you said we're talking about physical distancing as well. So is that something that people are starting to emphasize more the physical distancing way of talking about what we need people to do as opposed to the term of social distancing? I'm wondering if we're seeing a change in terminology for a specific reason to try and get people to change their behavior.
That's a really important point, and I'll answer it, and Jamie or Dr. Ronalds may want to weigh in on top of that. Social distancing or physical distancing, it's the same thing. If you no matter what environment you're in, the best thing to do is to stay at least 6 feet away from other people. And if you touch surfaces, wash your hands. That wherever there's an opportunity for the disease, the virus to spread, you mitigate the chance of spread by keeping that 6 foot distance and by washing your hands. All day long, we touch things that we're not even aware we touch. Door handles, elevator buttons, surfaces of countertops that other people may have touched where the virus may still be live, and it can spread that way. And so the key is to just wash your hands and keep that 6 foot distance. Now, for folks that are staying at home, that's the right thing to do. There are folks who can't stay at home. There are folks that are in essential jobs, and you look at examples like Eastman that have implemented social distancing within the workplace, where they're telling people keep a distance from each other. That's the responsible thing to do. And so if you're in an essential job, or if you're an employer that has essential functions, the best thing to do is to encourage your folks to keep that 6 foot distance and just lean on them heavily to wash their hands as many times as they can during the day. Jamie, is there anything you want to add to that?
I think some of the questions and that people were hearing when they heard social distancing was isolation. And so we really want to stress it's physical distancing. So, you can certainly be outside with physical distancing. I think we've got some great weather days coming up. So get outside. If you're social distancing, you don't have to sit inside alone. You can certainly go outside. You can use FaceTime. You can stay in contact with people so you're not in isolation. So we really want to focus on that physical distancing and not social distancing.
Thank you, Tim. Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Yes, thank you. My question would be, as you say, we're kind of at a base point. Would you be in favor, or Ballad Health be in favor of a lockdown if, let's say, the governor in other states, they've done lockdown? Would that be an advantageous thing here too?
Well, thank you for that question, and I expected that question. I've personally been in contact with the governor's staff. I talk to them routinely, as well as the State Department of Health. The governor obviously has important decisions he has to weigh. Whatever the governor chooses to do, Ballad Health will support it wholeheartedly. Look, where we're at right now, where you have restaurants, bars, fitness centers, bowling alleys, all that stuff that's recreational that's been closed down. So that's where we're at now. Even if the governor deploys a stay-at-home order, it's going to exempt key essential functions like manufacturing. It's going to exempt things like sanitary workers, water treatment plant workers, retail food, healthcare. You're still going to have thousands and thousands of people having to go to work. There's no real way to completely lock down. And that's what, if you look at the orders that other governors have done, they've exempted all of these different essential functions for the right reasons. So the incremental difference between where we are now and where we would be if the governor made that order, it's incremental in nature. The bigger issue is whether the governor orders it or not, if you don't need to be out in contact with people, don't do it. And that's it. Listen, the president has given very loud voice, thank goodness, to the people who have lost their jobs or who are economically stagnant right now and are struggling. That's really an important issue, and the two are tied together. The longer we let this thing spread, the longer it takes to get our economy back. So the fastest way to get from here to where we need to be is to slow the spread of this thing down enough that it gives the researchers, the time to create the vaccines that'll help actually stop it. So I know that's a big answer, but I think if the governor announces a stay-at-home order, he would be well within the good guidance to do so, and I think we would be full-throatedly in support of it if he does it. If he chooses not to, because of the reasons I just told you, that there are limitations to it, there's we understand those as well, but the message is still the same no matter what. If you don't need to be out, if you don't need to be in close proximity to people right now, just don't do it. Let's give ourselves the best chance of not having a surge of cases. If you look at what's going on in New York, and it's starting to happen in Atlanta and in New Orleans, the consequences, it's not about the hospitals. It's not about whether we're going to be overwhelmed from the standpoint that we don't want to be overwhelmed. If we get overwhelmed and we don't have enough ventilators or enough ICU capacity, that means there's a chance people will die. And that's the issue. It's not because we're afraid of being overwhelmed. Trust me, our staff is pretty good at handling just about anything. But the limitation is if we don't have the resources, the supplies, and the capacity, then not only would people affected by COVID-19 potentially face death, but other people who need that ICU capacity or ventilator capacity may not have it available to them, and they can die. And so that's why it's so critical, whether the governor announces it or not, the message is the same. It's 100% what the mayors talked about yesterday. Stay at home. And look, if you look, most people are heeding this. The population I'm most concerned about, to be honest with you, is those younger folks, young adults. I understand that young adults realize that maybe they're not getting impacted as severely. That doesn't mean they're not being impacted, and it doesn't mean that we're not seeing young people, although we haven't seen it here. We are seeing in other parts of the country where young people are getting very sick and are needing ventilator level of care, high-level ICU level of care. They're not totally immune from this, but there's an awful lot of them that have had a lot of contact with their friends, and they now are carrying it and potentially spreading it. And I think that's the message. The majority of cases, at least through yesterday, were under the age of 50, and that means that there are populations of people that are continuing to spread it, and they're perhaps not doing as much as they can do to socially distance themselves.
Jamie, anything else?
Don't think so. Thank you.
Thank you. John Hellman with Cumulus.
I didn't realize there was this many reporters.
There's more.
Okay.
John, do you have any questions? Yes, John has dropped off. Richard Rourke with the Irwin Record. Richard, do you have any questions?
Yes, I'll do both of mine in one question. In regards to the Unicoi County case, can you give us more information, such as the age and sex of the person that tested positive? And in regards to Unicoi County, how many tests have been made out of that county?
We can't answer the first part because it's potentially individual information and confidential information, or protected rather. The second question, I can't answer right now, but we'll get you an answer. I don't want to hazard a guess, but we'll get you an answer. And we sure appreciate all our folks in Unicoi, in America's newest rural hospital. Hope it's all going well there. We've had some great discussions with Eric and the team there, and they're doing a great job.
Thank you, Richard. I'll follow up with you. Scott Robertson, our last reporter with the Business Journal. Scott, do you have any questions?
Yes, thank you. First off, Alan, you and I have been talking since you got to this market about regionalism, and this has kind of been a kick in the pants that has gotten some regional efforts underway. We've seen the United Ways, we've seen Region
Scott, I mean, that's a great question. I think what we're seeing is that we are better together as a region. Whether you're in Russell County, Virginia, or Lee County, Virginia, or Unicoi County, Tennessee, you're part of a large family. If you're part of the Ballad family, it doesn't matter where you live in the region, you're part of the family. And, we're trying to address this as a team, as a family. And the same thing's happening in the community. There were no county lines when Eastman donated materials to Streamworks to make face masks for Ballad. They didn't say these can only be used in Kingsport. They said, we want to help the whole region. And so we're seeing the best of what we can be as a region. And I frankly am very inspired by that. And I don't think, right now we're focused on responding to a common threat. But and I hate to transition that discussion over to an economic one, but economic stagnation is economic stagnation is also a threat. And the best way to help people get better health, the best way to improve the health of a region is to reduce poverty. And you reduce poverty by creating economic opportunity. And that's what the regional discussion, not just in the Tri-Cities, but throughout the entire Appalachian Highlands, which the Tri-Cities is an incredibly important part of. It's the Appalachian Highlands isn't Bristol, Kingsport, and Johnson City. It's just as much Smith County, Virginia, Lee County, Virginia, Wise County, Virginia, Unicoi County, Tennessee, Hawkins County, Tennessee, as it is the three Tri-Cities. And as an entire region coming together, no matter whether it's to fight an invisible enemy like the virus or it's to fight poverty, the result can be the same if we focus our collective resources on identifying what the target is and going after it. And I have no doubt that as a region, we're going to be successful because we're showing that we're capable of doing that. Was that the last question?
Maybe one more.
Okay, Scott, did you?
Scott, anything else?
Yeah, and real quick before I get to the second question, let me lobby you for something. When you talk with the governor, mention the media as essential when it comes to essential versus non-essential for obvious reasons. The second question, and you touched on this yesterday at the Sullivan County Health Department, we see the economic pain in the region already now, but if we do this right, we won't see a lot of impact of the virus itself because of physical distancing and whatnot. As time goes by, though, it'll get harder to hold off that psychological fatigue of the economic problems. How do you get folks to maintain the discipline in what we need to do to beat back the virus?
Scott, that's important. I tried to touch on this yesterday. I shouldn't have just touched my face. I apologize. I know I just did that. Not funny. I shouldn't have done that. I touched on that yesterday, because this whole thing now will give rise to behavioral health issues. Never mind if it keeps going, it's already happening. I mean, you've got people that are at home who are terrified of what they've lost, not knowing if they're going to be able to get it back again. And I'm not just talking about people that are unemployed. I'm talking about doctors. I'm talking about nurses who've lost their practice and who have lost their savings and are not knowing if they can rebuild even their practice. The mental health issues that come with something like this they're not little, they're big issues. And so I was glad to see the Senate include in their package help for expanding mental health services throughout the country, especially in rural areas. I know that Frontier is focused on this, as are we. So we're in the process internally of discussing what we can do to stand up additional access. I know that this is a problem that's already going to begin surfacing. We're concerned about increased use of alcohol, increased use of other types of whether it's smoking or drugs or just sheer hopelessness. And so these are real problems, Scott. And I don't think that we have the luxury of waiting to come up with a plan for it. I think we've already begun that. And hopefully in the coming weeks, we can work collaboratively with our partners in the community and at the state level, states, to deploy the resources that are needed to help people who might need it. And I will say this, if you feel you need help, we'll put some contact information out there later today of organizations that you can call, whether it's Ballad Health, whether it's Frontier or other support organizations in the community. We'll put some numbers out there that you can call. Don't think you have to shoulder this alone. If you need to talk to somebody, do it. It's not, there should not be a stigma attached with asking for help. It's not a sign of weakness to ask for help. It's a sign of strength. All of us have our limitations, myself included. We all need help at times, and it's important to ask for help when you think you need it. So I think that's Scott, you mentioned an important point, and I think it's important for the whole media to start talking about this. I think we need to put contact information out there for people to call if they're in crisis or if they feel they need to just talk to somebody to get help. Because and we don't need to wait until we get to that point of total fatigue, because I think it's already happening, and we need to be available to answer them. And you're right about the media, and I can't underscore it. Dr. Runnels said this earlier. I can't thank the local media enough. Trust me, I don't always agree with your stories, and sometimes I wish your stories were very different. But this is the time where free media shows its intrinsic value to the public. There's so much information that needs to be out there, and frankly, we need to be challenged on what we're doing. What we're doing at times may be very good. Sometimes we might make a mistake, and the public does have a right to have visibility on that. So we are grateful for the questions you're asking. Hopefully, we're being as transparent as we can be, and we certainly hope that'll continue. And I can't imagine a scenario where the media would not be deemed essential, but certainly I'll pass that along. And now I'm going to go ahead and thank everybody and conclude this. Appreciate all the questions, the support, and whoever put that sign in front of the Ballad Health sign out front, you have no idea the impact that had on our people. We thank you for it, and if you see it on Twitter or Facebook, feel free to spread it so all of our team members can see it, because they deserve to see how much they're appreciated. Thank you.